Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about early entry into prenatal care. And our special guest is Miriam Dobson, a nurse with the Frederick County Health Department Maternal and Child Health Program. Miriam, welcome and thank you for joining us.
Thank you for having me, Dr. Brookmeyer.
All right, well, let's start first with what is early entry into prenatal care?
Early entry into prenatal care is defined as a woman who's finding out she's pregnant, entering into her first prenatal visit within the first 3 months of pregnancy, also known as the first trimester of pregnancy, which is the first 12 weeks of pregnancy.
Okay. Well, then why is it important that a woman would start prenatal care early?
Starting prenatal care early is vitally important for the health and safety of that mother and that pregnancy because it can help to detect certain issues that may go undetected if there's no prenatal care, and potentially treatment can start earlier as well.
Okay. Can you talk a little bit more then about some of those significant benefits from early prenatal care?
Some of the significant benefits of early prenatal care include having a better pregnancy outcome, which can mean having a baby 39 weeks of pregnancy or later. 39 to 40 weeks is considered the most beneficial time frame to have a baby, or to deliver a baby actually, and also having a baby of normal birth weight.
Okay, all right. And for our viewers out there, can you define what is low birth weight and early delivery?
Okay. Early delivery is considered a delivery that occurs at 37 weeks of gestation or pregnancy or earlier. And a low birth weight baby is defined as a baby whose birth weight is 5 pounds, 8 ounces or less.
Mm-hmm. Could you go over some of the potential complications that might occur if a baby's born with low birth weight or born premature?
Yes, there are many potential complications when a baby is born too soon or of a very low birth weight. Some of them can include brain bleeding. Some of them can include some breathing difficulties because of immature lungs or immature function of the lungs. There may be some cardiac abnormalities as well, and as also some GI issues that can occur. Babies may have sleep apnea, that is being unable to breathe for 20 seconds or more, and this may require the baby to be put into the neonatal intensive care unit for further evaluation.
So all things that I'm sure every parent would like to avoid if they could.
Absolutely.
Yeah. Well, how has Frederick County as a whole been doing in terms of early prenatal care?
Well, over the last 10 years, there have been some fluctuations with early prenatal care. But if we look at the year 2011, in total, Frederick County had nearly 3/4 of every woman who delivered from Frederick County access prenatal care in the first trimester. And on the face of it, that may look good, but as we compare with state and government goals, most especially with Healthy People 2020's goal, we actually fall short. So it's really vitally important that women do enter prenatal care in the first trimester. We were actually 5% short of what the Healthy People 2020 goal was. And 5% really translate to 100 more women accessing prenatal care in the first trimester. So we're talking about numbers and we're talking about goals, but it's really about healthy women, healthy babies, and healthy pregnancies.
Wow, and right, and so that it's a big number, but it also sounds doable.
Absolutely.
To be at least to reach the minimum target, but ideally we'd have 100% of women having their care starting their prenatal care in the first trimester.
Trending up towards 100% is always a doable goal and a desirable goal.
Very good. So are there any other tips that you'd like to talk about for promoting a healthy pregnancy?
Surely. When a woman is not pregnant, it's important that she adopts some healthy habits. Those healthy habits include incorporating folic acid into your diet, and especially through supplements such as multivitamins. 400 micrograms is recommended for a woman to take daily, and that will help to prevent certain neurological birth defects that can occur in the first 3 months of pregnancy. Also, maintaining a healthy weight is very important. Avoiding substances. When I say substances, I mean smoking, drug use, alcohol use, because that can potentially decrease a healthy outcome of a pregnancy. And most importantly, when a woman learns that she's pregnant, enter into prenatal care as soon as possible. We have providers in Frederick County that can provide prenatal care to women who have private insurance, state insurance, and even for women who have no insurance.
Well, Miriam, that all sounds great. Sounds like there's plenty of opportunity out there for women to start their prenatal care early, and I hope that you'll be successful, and you and your colleagues successful in reaching at least the minimum target that's been set for women in Frederick County to enter into prenatal care early.
Absolutely. When Frederick County women are healthy and the community as a whole is healthy, we're successful.
Sounds very good. Thank you for joining us.
Thank you.